So I do look forward to the opportunity to meet you today and share a little bit about our vision and what we're doing, not only in supply chain, but what we're doing here at Intermountain as a whole. But we're going to have a good time today, and I do really appreciate all of you being here. This is a unique event in the industry, and I think it represents, in many ways, the uniqueness of Intermountain and our ability to recognize those that help us be successful every day, that help us ultimately enliven our mission of helping people live the healthiest lives possible. We can't do that by ourselves. It requires support, collaboration, expertise, knowledge that we need to reach outside of our four walls of our organization and enlist that help and support from all of you.
I'd like to share some thoughts with you today about how Intermountain is thinking about health and healthcare, and invite you to be partners with us. Some of you are already, in a different way of thinking about this. And I am the first to admit that I don't have very many ideas about how a supplier partner could help us with some of the challenges that we're facing or understanding in a new way. I often approach things from a healthcare mindset, but I'm trying to think more broadly, and I hope I invite you to think more broadly with me today. So Utah is a pretty healthy state. And so for a leader of community health, I could probably say, well, we're number 4. This is pretty good. We're the 4th healthiest state in the country. And yet, Intermountain's pretty competitive. So Dr. Harrison won't let me just be satisfied that we're the 4th healthiest state in the country. We have to be number 1. And so we're aiming for that. And it's going to take a lot of work. And I want to help you understand a little bit about what contributes to our ranking, some things we can be very proud of, and some things that we have a lot of work to do. In understanding this, we've created a lot of partnerships. Understanding public health indicators is something that a health system understands in one way. And so we've partnered with all of the departments of health across our state, our local mental health authorities, people like the Gardner Policy Institute who understand economics and the context of things to understand health in Utah. And as a result, we've produced a community health needs assessment and published our community health priorities. So as we think about that health improvement, we have to do so within this context. And I think it makes it all the more important that we're very thoughtful about how we approach our scope, how we think about our stewardship as a health system in the community. Now, just like any health system, we have our ways we define ourselves, our counts of hospitals and clinics and other things. But as we build out this slide over time, particularly in the last couple of years, we've added some things that I think a lot of health systems might not include. Our hospitals are not just physical places now. We have a virtual hospital. It's opened January 1st of this year to treat people beyond our physical walls and create access to care in other settings. We're now serving through our telehealth capability in 5 states and 32 different locations, virtually, with a team that's back here in Utah. And of course, we're focusing on delivering care face-to-face in our clinics with our 37,000 employees and trying to reach people through our members. We now have 875,000 members that are a part of Select Health in all types of plans, from Medicaid to Medicare Advantage, exchange products, et cetera, trying to reach the entire community. And beyond those that have access through one of our health plans, we serve the uninsured, anyone, regardless of ability to pay. And last year provided about $225 million in charity care. Half of that was provided to people like the couple that you saw in the video who are insured, but that insurance doesn't necessarily mean healthcare is affordable. And for someone whose healthcare expenses are going to exceed 30% of their income, we absolutely have to step in with our financial assistance, and we do. About half of the people who receive financial assistance from Intermountain are insured in some way. But there's a lot of vulnerable people that can't access healthcare because of through insurance or don't feel they have access through a regular provider. So we also partner with 52 safety net clinics across the state of Utah and in southeast Idaho who are located in medically underserved communities with a specific mission of reaching those who are underserved. And we support them financially. We also provide vouchers that allow them to directly access services from that clinic within Intermountain when they need specialty care or diagnostic services that aren't provided in those community health centers. And then when clinics aren't available, through community partners, we open clinics. We have 5 clinics that we've opened specifically in communities that otherwise have no access to health care. And this is important in how we address challenges like the opioid crisis. So we have a very broad health system that we just talked about, but our role is really minimal. If we go back to that concept of how health is determined, we're very cautious to celebrate this, but I'll share it with you because the New York Times shared it 2 weeks ago. Data that the CDC published just days before this shows that for the second year in a row, Utah is one of very few states across the country that's seeing a decline in the rate of opioid overdose in the country. Most states, so all of those in the peach and red tones there, are seeing an increase in deaths compared to the prior year. Utah has seen a decrease 2 years in a row. We're now ranked 12th in the country compared to being ranked 5th. And we're pleased. We're also very cautious. We know that before you see a problem like this really solved, there's a lot of other factors.
We've been trying to develop this program over the last few years to try to make it meaningful to all of our suppliers. And it's pretty simple. To actually recognize our suppliers, all of you, for making a difference through exhibiting the right attributes and behavior in the pursuit of excellent patient care. As we've heard a lot, our mission is to help people live the healthiest lives possible. And I would suggest the only way that we can do that is through all of you. So today, our first Supplier Award for 2018 is our Corporate Social Responsibility Award. As we heard from Mikkel Moore, Intermountain is trying to involve itself into the communities that we serve. And we've developed this award for a supplier that demonstrates positive social and environmental change in our communities. Dr. Harrison, Mikkel, and others are very supportive in what we're doing. One of our goals this year in 2018 is to develop a sustainable procurement program. That includes both a supplier diversity program, local sourcing program, and a sustainability piece as well, as Mikkel mentioned. So ladies and gentlemen, please join me in congratulating our 2018 Corporate Social Responsibility Award winner, Jacobson Construction.
The story that I'm going to tell you right now is a One Intermountain shared services story. And it goes like this. It was a cold, snowy day in December. Actually, it was in January of 2016, and I was in a meeting with my boss, Rob Allen, and he told me that the operating model of Intermountain Healthcare was going to change. He said that some of the clinical services were going to be operated in a shared services model, and he emphasized for me the importance of making the services better, more consistent, more patient-centric for all of the patients and families that we serve and for our teams of caregivers. And he said that the intent of changing the model was to position Intermountain Healthcare for future success. So, in our short time together today, I'm going to describe to you our shared services model and explain how we use it to improve safety, quality, access, our patients' experiences, and stewardship, because it is the model for the future. All of our shared services have very detailed service level agreement, and these serve as our governing documents. And a well-written service level agreement that absolutely should delineate roles and responsibilities. It should describe the deliverables and the timelines. It should clearly explain who is accountable for what, and it should also describe the mechanism for oversight and feedback. My recommendation to anybody, whoever is leading a shared services model, would be to take the time needed up front to really think about what needs to be in that document. And the reason that I say that is if you get it right, or even if you just get it mostly right, it will put you on a trajectory for success.
So it's my pleasure today to just kind of share some thoughts and stories about Intermountain Healthcare as we approach the future, and specifically our fiduciary responsibility in this community and in others to make sure that we are a forever organization, that we are here to provide services for this community for the duration. And in order to do that, we need to be very, very thoughtful about how we approach our financial strategies. But all of you that have gone to the doctor, gone to a hospital, know that it's still incredibly expensive, and really more expensive than it needs to be and it should be. So here's another graphic. So this shows, again, the delta between the national benchmarks and Utah is favorable. If you look at it from a perspective of how is Utah doing relative to the rest of the country, we are significantly less costly, which is a good thing. But also, if you look at where we've come from 1991 until 2014, which is when this data was published, you'd see the trajectory there is significant and frankly unsustainable. If we were to extrapolate that out into future years, we're getting to a point where we've reached a tipping point where we just cannot continue to pass those financial burdens along. And so despite the fact that Utah is doing well, we're still not doing well enough. And that's where we need to be really, really thoughtful about how we approach the future. One thing here is what's a product that's called Select Health Share, which many of you may be aware of, which is partnering with these large employers to say, how can we keep our employee base healthy? How can we keep them engaged in their wellness and in their care? And if there's mutual agreements and alignment to partner on this and to provide certain key provisions and commitments, then we actually, as Select Health, guarantee that those rate increases will not increase more than a predetermined amount. Over the past couple of years, that predetermined amount is that it will not exceed 4% in those years, and more recently that has been reduced to 2.5%. So showing how our commitment to keeping healthcare costs low will then translate into better access, better affordability, and predictability for these large employers that are grappling with these very real cost increases.
This award reminds both our suppliers and Intermountain of our responsibility of financial stewardship to the communities we serve, and for demonstrating a positive social impact on cost, quality, and outcomes. So it's my pleasure to announce Right Sourcing as the 2018 CQO Award winner. Right Sourcing was selected for the CQO Award for decreasing costs, maintaining quality, and improving outcomes, which resulted in millions of dollars of savings over the last 2 years. The Supplier Neutral Staffing Program has managed over 1,100 temp staffing assignments and $57 million in spend, resulting in $3.6 million in cost savings.
I'm happy to come and share with you, our partners, what we are doing and invite you actually to come on this journey with us. And I think there's a lot that we can do to partner with this together. But we're here today to talk about this method, which is the Intermountain operating model. This is how we're trying to differentiate us with respect to operations and strategy, et cetera. You know, this is how we are trying to improve healthcare. And we're going to share with you today what this means. You know, 30 minutes isn't enough to really dive into any great detail with this, but we want to give you an overview so you understand what we're doing as a healthcare organization. Why, if we did this before, did we not sustain this? This is what we're talking about. We're trying to create this culture where this is sustainable. And a big part of this is not having a team of experts come in and do the improvement and then move on to the next project. What we're trying to do is have 37,000 caregivers, we call our employees caregivers, involved in improvement. And we'll talk about how we're trying to do this, because we're trying to create a culture, and we'll talk about who owns the culture, et cetera. This is how we define continuous improvement. It's simply a method to engage all caregivers, and it doesn't matter who you are in the organization, this applies to you. And this is not just our employee caregivers, but we're also talking about affiliate physicians, and other groups that work with us. But we want to systematically increase the value provided to our patients, members, those that are members of our health plan, and all of our caregivers. This is, at its most basic element, this is what continuous improvement is all about. And a surprising number of them have not been able to answer that question. Now, I think they're able to answer that question with a little bit more clarity and a little bit more confidence. But this is clear expectations of what it means to be successful from the very top of the organization all the way down to the frontline caregiver. We want every caregiver to come to work every single day knowing that what they do contributes to the success of the organization. And you can only do that if you have aligned strategy. If they know that through a cascade, we'll show you, I'll show you this, the cycle here shortly, but we can only do that if we've cascaded that strategy very purposefully across the entire organization. So this is our strategy deployment cycle. I'm not going to get into detail with this either, but we start with true north statements. You've perhaps already heard of our fundamentals of extraordinary care: safety, quality, patient experience, access, stewardship, engaged caregivers, and where appropriate, growth. Those are the true north statements. How do we know that we're succeeding with those true north statements? We need key performance indicators. That answers the questions, or the question, how do you know if you're winning or losing? And so we've devised key performance indicators, not goals, not temporary measures of success. These are key performance indicators that stand the test of time, something that we have looked at the last year, we'll look at this year, and something that we're going to look at for the years that come. This is how we can measure success for our organization, and then once we know that, how are we going to go about doing this work? That's where these strategies and initiatives come in, and we use scientific thinking using A3 thinking. Many of you are probably familiar with A3 thinking, but just having a business plan actually for how we're going to achieve this together with tactics and actions. The teams are now able to say, this is what I'm doing every day that aligns with where the organization wants me to go.
When I joined, it was, Intermountain had just acquired Insularis a year or two before, and collaboration and partnership with Intermountain was certainly something that attracted me, and that proved to be a valuable point. We worked very closely with Intermountain in 2017. We were given a goal of $6.5 million to help drive value for Intermountain and their patients. And after I joined, the team was already in flight, but we started to accelerate our progress against that goal. Ultimately, we were able to achieve $7.43 million in 17. But more importantly than that, we built the what I'll call the integration points, or the structural process integration that really we continue to reap the benefits of to this day. So we aligned our processes, had a similar nomenclature. As Dr. Pollard mentioned, it's very important that across the system we all have the same understanding and framework that we operate from. One of the key components is how important is this to our members. So our member input boards and member input groups are really a great vehicle for us to take in that interest. So one example, and again, Supplier A, we'll call them, is in diabetes management. It really, not just focusing on the price for diabetes management, but really how do we go about training patients and staff on how best to manage their diabetes so that they get the best outcome possible. So it's really an educational opportunity. Ultimately, this drives value because they have proper Lancet usage and they reduce cross-contamination.
This award is for demonstrating excellence in supply chain efficiency and innovation. So I'm honored, actually. I'm honored to announce the 2018 Supply Chain Excellence Award winner, McKesson Corporation. So McKesson was selected as this year's recipient for providing support on several of our strategic goals, including inventory optimization and generic drug price reduction. McKesson also helped mitigate shortages by working proactively with suppliers and Intermountain stakeholders to provide appropriate allocations and products for our patients. McKesson has partnered with Intermountain Healthcare since 2012 to lower total distribution costs by integrating deliveries to Intermountain Healthcare pharmacies using Intermountain Healthcare's own existing courier network.
It is my personal belief, and potentially the belief of many others, that what I'm going to share with you today will constitute a significant part of the future of Intermountain Healthcare in the realm of improving value as we deliver surgical care to our patients. The concept here is that the Center for Value-Based Surgery can interact with the existing organization of Intermountain in a way that assists the organization, and in particular the clinical programs, interact with the supply chain in such a way as to improve value for our patients. In particular, our plan is to address three specific areas. Number one, we are going to address the large capital purchases for Intermountain in the OR space. These are things such as anesthesia machines, lights, imaging, endoscopy imaging, laparoscopic imaging, arthroscopic imaging, in addition to various other kind of larger capital purchases that Intermountain does. In addition to that, we'll spend some time dealing with some of the smaller device-specific purchasing, such as endomechanical and screws and plates and all of these things that are part of the care that we deliver to our surgical patients. And then finally, one of the critical issues that we view for this Center for Value-Based Surgery is to figure out a way to incentivize clinicians as they engage with their patients, as they engage in the care of surgical patients in general, to align themselves with Intermountain Healthcare in particular, but really healthcare in general. It will all of a sudden bring into the interaction that our clinicians have with their patients standard market forces that actually affect everything else. I don't know how many of you have ever had somebody come work on your house or built a house or gone through that process, right? But you know, when a plumber is working on my house, they make a bid. I then tell them I'm going to pay that much. And then they go get the parts, and they do the labor, and once it's done, I pay them. And they are, at that point, and going through this process, dealing with kind of an open market process with much more transparency. Our hope is that by making this information available, we will be able to drive clinicians to think about total cost of care and the quality of care that they deliver in a much more open fashion.
So our final presentation this afternoon is for a Collaboration MVP Award. There's a quote that I really love that says, "Competition makes us faster, but collaboration makes us better." I think it's so true in any aspect in our lives. And it's very true in the healthcare space as well. So collaboration is, we talk about it a lot. We think it's very important, but it's a fundamental concept of any relationship. And we have selected this award to recognize a company that demonstrates genuine capability and willingness to collaborate to develop a mutual trust relationship based on proactiveness, responsiveness, and transparency. So ladies and gentlemen, please help me congratulate our 2018 Collaboration MVP Award winner, Johnson & Johnson Medical Devices. Johnson & Johnson has excelled in providing a single point of contact for more seamless interaction between our two organizations. Because of this culture, we have cultivated an environment that has led to a number of meaningful post-contract value-add opportunities over the last year. A few examples include collaboration on price discrepancies improvements that has led to a 98% price accuracy. A number of logistical improvements at our fulfillment center that have led to a higher rate of perfect order status, shared incentives to appropriately utilize Intermountain's fulfillment center.
But I do have some points that I want to get across. And really that's around adopting this approach of helping make supply chain your net promoter in our organization. They don't embrace the supplier community in a way, frankly, we're trying to at Intermountain. And why does that exist? Well, there's all kinds of problems. One is related to poor communication. We've heard that a couple times today, right? If we are not openly communicating our interests, our goals, being transparent with our barriers and our hurdles that we've got to get through, then we are not going to be successful together. We will have a non-symbiotic relationship if we can't address communication. If we don't have good communication, we will not have good trust between our organizations. That is the foundation of our success, is we have to have trust. We haven't historically been aligned. Part of that is, again, tied to poor communication. If we're not telling you what's important to us, and frankly, you're not telling us what's important to you, then we're going to be challenged to be aligned and be successful. Lack of understanding. I think this still very much permeates our industry today. Suppliers don't fully understand providers and their limitations. Providers don't understand suppliers and their limitations. And the only way we get past that is by improving our communication, having trustful relationships, getting away from the concept of winners and losers. Nothing's going to be more detrimental to our relationship if we view it through the lens of winners and losers. I put this one on here because I strongly believe this is a contributing factor to some of the problems we've had in the healthcare supply chain space, is talent deficiency. The vast majority of the relationships out there are transactional relationships. And frankly, there's not a lot of effort being put forth on the provider side to change that. So we want to set the example. If we are having a supplier relationship who's providing us the highest quality product at the lowest possible cost in the most efficient manner, they're bringing value add to the relationship, and we are building a positive, trustful, open, honest, genuine, and innovative approach to what we're doing, why would I change? I want to be supplier X for life. In the absence of something innovative and really disruptive coming to the marketplace, that's not unrealistic. We can do that. But it takes a different approach to the relationship. We often refer to kind of the value of the contracts we execute in two buckets. We generally say at Intermountain that 25% of the value we extract from the relationship is done at the time of contract execution. 75% of the value of that relationship is over the life of that contract or over the life of the relationship. We can't get that value if we don't come to the table and work together.